Hello guys, so today we shall be discussing an important topic, that is Epstein-Barr virus. All of you know EBV, right? EBV means Epstein-Barr virus, which is also called as Human Herpes-4 virus. So let's get started now. So our topic of discussion will be Epstein-Barr virus. Epstein-Barr virus stands for EBV. Right. So as I already told you, the other name for this Epstein-Barr virus is what is the other name, guys? The other name for this is Human Herpes-4 virus. Okay. So Epstein-Barr virus is also called as Human Herpes-4 virus. So if I ask you what is the most common cause of infectious mononucleosis, or simply called as mono, right? So if I ask you what is the most common cause of infectious mononucleosis, most common cause of infectious mononucleosis is EBV or HH4, I mean Human Herpes-4 virus. If you look at the structure of the virus, guys, how does the virus look? If you the basic structure, okay, look at the DNA. This is the DNA of the virus. Now, how is this DNA, guys? How is this DNA? Is it circular or is it linear? Obviously, the DNA is linear, not circular. Okay. Next, it is covered in this way. There is an envelope. Okay. And surrounding that, you have got a very beautiful capsid. Surrounding that, you have got a very beautiful capsid. Next important thing is that you have also got some projections like this coming out of this virus. Can anyone name what these projections might be? Yes. First of all, do you call them as projections or what? What is the other name for this? These are called as spikes. And what spikes are these, guys? These are called as glycoprotein spikes. What are these spikes named as? These spikes are named as glycoprotein spikes. Glycoprotein spikes or glycoprotein spike proteins. Glycoprotein spike proteins, or simply for short, glycoprotein spikes. So these are glycoprotein spikes. And next, look at the DNA. Okay, let me write the things which you are about to see here. Point number 1, how is the virus? Yeah, virus is having an DNA inside, right? It is circular. Obviously, virus is having a DNA and DNA is linear. So it is having a double-stranded DNA. Okay, and this double-stranded DNA, is it circular or linear? Yes, guys, it is linear. Okay, next, after this, point number 2. What is point number 2? Point number 2 is it enveloped? Yes, it is enveloped. Next, point number 3. What is point number 3, guys? Point number 3 is, this belongs to which family? This belongs to Herpesviridae family. Herpesviridae family. Okay, so overall, guys, a simple introduction of these virus. It is the most common cause of infectious mononucleosis, right? You have got the glycoprotein spikes surrounding it. It is enveloped, double-stranded, but linear, not circular, and it belongs to a family called as, yes, it belongs to a family called as Herpesviridae. How is it basically transmitted? How is it transmitted? What is the transmission route? Obviously, most of the viruses, the transmission route will be respiratory droplets, right? Yes, even this virus is transmitted through the secretions. I mean the salivary secretions. Transmitted through salivary secretions. Not only salivary secretions, guys. I mean salivary or, you know, any kind of respiratory secretions. Respiratory secretion. Second important thing is that this disease is transmitted by kissing, because when you kiss, the saliva, it transmits to the next person, right? So most commonly, if I ask you how this disease is transmitted, mostly it is transmitted through kissing. That is why they have named this disease as kissing disease. They have named this disease as kissing disease. They name this disease as kissing disease. Okay. Now, important thing. What is the important thing? Which age group is most commonly gonna affect with the, gonna get affected with this Epstein-Barr virus, guys? So, which age group gonna perform this kissing activity most commonly? That age group which are adults, right? So, most commonly the adults, the young adults, right? So, young adults in the back gate. So, they are most commonly affected with this kissing disease. Okay. Now, second important thing which you need to know is that how will this virus, for example, if a patient kisses someone, how is the virus going to enter into his body and what pathological changes can cause in that patient? First of all, if someone is really kissing each other, now let me draw the lateral surface of the face, and show you what exactly is happening. Okay, so obviously, you know, when someone kisses, what will happen? The virus enters into the oropharynx. All of you know what is oropharynx from my previous lectures, isn't it? So let me draw the lateral part of the face and explain how this virus enters and step by step how it is going to enter into your body and how your immune system is going to react to this virus, everything we shall be discussing right now. So look here. Right. So this is the patient over here, right? This is the patient here. Now you know that the patient basically has his beautiful nasopharynx, even as his oropharynx. And all of you also know that the nasopharynx and the oropharynx join together to form what? Laryngopharynx. So intentionally I am drawing the laryngopharynx a little bit large so that I have to draw some cells over here. Okay. Now inside here you have got some epithelial cells. These are called as pharyngeal epithelial cells. I am not going to mention them what type of epithelial cells they are, but anyways this is not histology. There are some epithelial cells here. Okay, so let me put a nucleus to make you happy, telling that these are epithelial cells. Okay, fine. Next, you also have got tonsils, right? So anatomically it might be wrong, but you know, let me draw some tonsils over here. This is a tonsil, this green color thing is a tonsil, and obviously you even have epithelial cells above that all the way like this, right? Put two dots in the center. So these are this is the respiratory epithelium. Now another important thing is that, for example, due to the salivary secretions or due to kissing or whatever the respiratory secretions it might be, so what is happening, guys? What is happening is the virus particles enter into the mouth and they enter into the oropharynx, right? So the virus particles are right now in the oropharynx. So what will happen? What will happen is that, so I will indicate the virus in this way, look here. So this is a red dot and this is the virus, okay. Don't think it is a sun, it is a virus. Obviously they are called as the spike proteins, right. So the virus is right now inside your respiratory epithelium. Now what will happen here? This virus has to enter into that epithelial cells. Okay, this virus has to enter into that epithelial cells. So how will it enter into the epithelial cells? Everything we shall be discussing right now. Okay, but before that, another important picture I want to make here is that here you have got a blood vessel, right, which supplies your pharynx. Keep that thing in mind. This is the blood vessel which supplies your pharynx. So now I am drawing a simple picture. Look here, just concentrate here. So this is the lumen over here, right? All of you can see your lumen here. This is the laryngopharynx, for example. Okay. Now what I am trying to draw is that these are the epithelial cells which we previously discussed, right? So these were your epithelial cells. On both the sides you have got your respiratory epithelial cells. Okay. Now look here very carefully, what is going to happen? What will happen is that these are the respiratory epithelial cells over here. Okay. So right now where is your virus, guys? Where is your virus? So this is your virus, right? Now this virus will attach to the epithelial cells. After attachment to the epithelial cells, the virus will enter inside the epithelial cell. Okay, so this is the virus entering inside the epithelial cells. Once after entering inside the epithelial cells, obviously each epithelial cell has got its own DNA, right? So this virus will manipulate the entire cell, will manipulate all the cell organelles, will manipulate the DNA of the host cell. Host cell means our epithelial cells. It will manipulate all these things in such a way that finally the virus will start replicating using our own DNA. It will start replicating. So what will happen? Many virus particles are released. Many virus particles. As you can see, many viral particles are released in this way. So as many viral particles are released, now what will happen? All these viral particles will damage the DNA of the host cell. It will even damage the epithelial cell, and finally they are released outside. So in the next picture you can very clearly see how the epithelial cells are damaged and broken down in this way. You see, the epithelial cells are damaged and broken down, and there is virus inside this. The virus inside is breaking those epithelial cells and entering into the lumen. You see, the virus is entering into the lumen now. So this is how the virus has damaged your respiratory epithelial cells and entering into the lumen. Now previously one virus particle entered inside, now many virus particles have released into the lumen. Now if this patient will kiss someone, obviously the virus is going to go all the way up and it can be transmitted. Clear? Now another important thing that can happen, I told you that there are also tonsils. Tonsils have drawn with the green color, right? So I even have to mention about the tonsils. So let me extend the oropharynx of this patient a little bit downward like this, okay, and let me draw the tonsil over here. Okay, so this is the tonsil of the patient. This is the tonsil of the patient. Just one tonsil over here. Okay, so now look what is happening. This virus, even it will enter inside the tonsils. It won't even leave the tonsils. This virus is also going to enter inside the tonsils. Okay, so this virus is even entering in everything. I'll write it, this is just a diagrammatic representation. Just listen to the class. Later on, I'll write everything in detail. Okay, so finally what is happening guys, this virus is entering into the tonsils. Once it enters into the tonsils, in your tonsils you have got B lymphocytes, isn't it? So let us say that this cell is your B lymphocyte. Okay, now this B lymphocyte will pick up that virus. But virus is so dangerous that the virus will attach to the B lymphocyte and enter inside the B lymphocyte. The virus is entering into the B lymphocyte. So this is your B lymphocyte. This was the molecule here, right? The receiving molecule. And finally, right now the virus is inside the B lymphocyte. And what is it doing inside the B lymphocyte? Even in the B lymphocyte, it will manipulate the B lymphocyte, and this virus starts dividing inside the B lymphocyte. You see, the virus is dividing inside the B lymphocyte. Okay, fine, the virus is dividing inside the B lymphocyte. What's next? What's next is that this virus, it will stay silent. This virus will not affect you, right? This virus starts dividing in the B lymphocytes and starts damaging the B lymphocytes, but this virus is residing, living within the B lymphocytes. It is not coming out. So if it is not coming out, it is not pathogenic to you. So it is silent. The virus is remained silent for how many days? It is silent for 2 to 6 weeks. So that is why this 2 to 6 weeks period is called as the latent phase or the incubation phase. So at this time the virus is absolutely silent, it is not causing any symptoms in you. But after 2 to 6 weeks, right, after 2 to 6 weeks, what will happen? What will happen is that after 2 to 6 weeks, the virus is going to blast this B lymphocyte completely, so that the B lymphocyte, these are the viral particles, right? The B lymphocyte is going to release viral particles into the lumen. This was the lumen, guys. Let me minimize the picture. This is the lumen, guys. So it is releasing the virus particles into the lumen. So right now, previously the virus entered into the respiratory epithelial cells, divided and got released. Now virus is entering into the lymphoid, into the tonsils and getting divided in the B lymphocytes, and finally it is getting released. So the amount of viral load now is much more than the viral load which was released previously when it came out of the epithelial cells. Epithelial cells were small, so few viral particles have released, but now the B lymphocytes, for about 2 to 6 weeks, they kept dividing, the virus started dividing in them, and finally a heavy load of viral particles got released into the respiratory epithelial cells. Clear, everyone? Right. Not only that, what is also going to happen in this patient? Apart from that, not only that, what is also going to happen in this patient is that, look here guys, let me draw another important thing. Virus is entering into the B lymphocytes, I told you, right? After entering into the B lymphocytes, the virus starts dividing within the B lymphocytes. So this happens in most of the B lymphocytes, but there are some very clever B lymphocytes which already knew that virus will enter inside me and take complete advantage of me and start dividing and breaking my body out. So for that reason, those B lymphocytes are very tricky. You know what they are going to do? Look here. What they are going to do is that, for example, this is the blood vessel over here. Okay, I am drawing the blood vessel small. This is the blood vessel. Now don't get confused from where this blood vessel came. I already told you, behind the pharynx you have got your blood vessel, right? So whereas some B lymphocytes, the moment virus enters into the tonsil, some B lymphocytes are so tricky, I told you, right? Some B lymphocytes are so tricky that these B lymphocytes immediately they rush into your blood vessel. And you know what they are going to do in your blood vessel? Look here. This is your B lymphocyte. They are going to rush into your blood vessel, and how they are going to rush into your blood vessel? They are going to pick up that viral particle and finally they enter into the blood vessel. So this is the viral particle they have picked up, and from here they enter into your lymph nodes where your lymphatic cells are present, right? So let us say this is an artery that is supplying your lymph node. This is the lymph node, for example, some random lymph node, right? So right now what will happen is that this B lymphocyte enters into the lymph node. This B lymphocyte enters into the lymph node, catching hold of the viral particles. So this is a B lymphocyte, and this B lymphocyte catching hold of the viral particle, it is entering into the lymph node. Clear, everyone? I'll recap at the end what has happened completely. Now, important thing is that this B lymphocyte all the way from the tonsils entered, it picked up a viral particle in the tonsils, entered into the bloodstream, from the bloodstream it entered into the lymph node, right? Is it only entering into the lymph node or any other organs? Yes, not only the lymph node guys, it will even enter into the liver, it will even enter into the spleen. It can even go into the liver, spleen or lymph node as it entered now. So once it enters here, what is this molecule guys? From that time I am showing it to you. What is this molecule with which it is showing the virus particle? This molecule is named as MHC class 2 molecule, major histocompatibility class 2 molecule. So with the help of this molecule, this B lymphocyte is showing the virus to another cell that is called as cytotoxic T cell, or simply called as CD8 T cells. So what I was telling you, that this B lymphocyte has got major histocompatibility 2 molecule with which it will show up the virus particle, and it is showing this virus particle to whom? It is showing the virus particle to cytotoxic T cells. Cytotoxic T cells are also called as CD8 T cells, right? So it is showing the virus particle to CD8 T cells. It is showing the virus particle to the CD8 T cells. Now CD8 T cells will look, analyze, and finally CD8 T cells realize that there is really some very big danger that is happening in this patient's body, so I need to act, I need to quick act. So what will this CD8 cytotoxic T cells do? They start releasing cytokines, and what will these cytokines do? These cytokines will suppress the EBV infection. It will suppress the Epstein-Barr virus activity. Okay, so what is this CD8 T cells going to do, guys? Let me write it down all the way down here. It is going to suppress Epstein-Barr virus infection. Not only that, sometimes Epstein-Barr virus is silent and again it gets reactivated. So even that will suppress the reactivation of Epstein-Barr virus. Suppress EBV reactivation. It will even suppress the EBV reactivation. So these are the two important things which you need to know what the CD8 T cells are doing. Not only that, B cells on one side it will activate the CD8 cells, right, suppressing the infection. On the other hand, what these B cells are doing, on the other hand, B cells even activate another special group of cells, and these special group of cells are called as CD4 T cells. These special group of cells are called as CD4 T cells. Even it will show up the virus particle to the CD4 T cells. Even it will show up the virus particle to your CD4 T cells. So this is a virus particle, and this virus particle is showing up to the CD4 T cells. Once it shows the virus particles to CD4 T cells, CD4 T cell is so happy that CD4 T cell will thank B cell for showing the virus particles. So how does it thank? How does it thank? This CD4 T cell will start activating the B cell. And when it starts activating the B cell, then B cell has got a very good chance. All of you know B cells release plasma cells, right? So these B cells, they convert into the plasma cells. So there are a lot of plasma cells that are released. Plasma cells are nothing but plasma cells later they form antibodies, right? So there are many different kinds of antibodies are released. Can anyone tell me what has just happened here? Simple thing, guys. B cells, they activated CD8 cells. CD8 cells are also called as cytotoxic T cells. Let me make a note. These are also called as cytotoxic T cells. They are also called cytotoxic T cells. And these cytotoxic T cells, they suppress the EBV infection, they suppress the reactivation of that EBV infection. On the other hand, B cells also activate CD4 cells. So when CD4 cells are activated, CD4 cells are so happy and they thank B cells in such a way that they activate the B cells. Come on, get up. So once the B cells get activated, then B cells start releasing plasma cells. And these plasma cells, they transform into antibodies. Right? Now tell me what antibodies are released here. General antibodies are released or EBV specific antibodies are released? Obviously, it is carrying hold of that EBV virus, so EBV specific antibodies are released. Antibodies against this Epstein-Barr virus are released. So those are called as EBV specific antibodies. So let me make a note, guys. These are EBV specific antibodies. EBV specific antibodies are released. Okay, can you name few EBV specific antibodies, please? Yes. What are these EBV specific antibodies? Look here now. These EBV specific antibodies are look here. Some antibodies are directed to the nucleus of the virus, whereas some antibodies are directed to the capsid of the virus. Okay, so some antibodies are directed towards the capsid to attack the capsid. Some antibodies are against the nucleus. So they are called as viral capsular antibodies, and the remaining are called as nuclear antibodies. Okay. Now, these capsular antibodies and these nuclear antibodies, look here, these capsular antibodies are two types. Some are IgM over here and some are IgG, but nuclear antibodies are only IgG. So, which two groups of antibodies are released? IgM, IgG. Some IgM antibodies, they attack the capsid. Some IgG antibodies attack the capsid. Here, some IgG antibodies attack the nucleus, because there are two antibodies that are released, IgM and IgG. Some are directed towards the capsid, some are directed towards the nucleus. Okay, so these are the important things which you need to know. Clear? Right. Now, when all this mess is happening, in the blood vessel, one very important thing I would like to mention is this, guys. During the incubation period of about 2 to 6 weeks, the virus is just dividing. It is completely silent, right? So, virus is dividing where? In the B cells. In the picture I have shown you that virus is dividing in the B cells, right? So, as virus is dividing in the B cells are in a lot of pain. They are trying to explain to the immune system that some random virus has entered into my body and it is affecting me. Now, how will B cell explain that symptoms to you? How will B cell itself is having a heavy viral load inside. So, in such cases, B cell will silently give you a hint. You know what? As this virus is dividing within the B cells, during the incubation period, when the virus is sleeping, these B cells suddenly they wake up, and these B cells, they start releasing some special antibodies, or also called as abnormal antibodies, into the blood vascular system. So, these are the abnormal antibodies, guys. These are the abnormal pink color antibodies which are released into the blood vascular system. You know what are these abnormal antibodies? Are called as heterophile antibodies. So, in this way, our B cells, while the virus is sleeping for 2 to 6 weeks, these B cells are releasing these abnormal antibodies and trying to contact you, trying to contact our immune system, telling that there is something bad happening in our body, right? So, these antibodies here are called as heterophile antibodies, heterophile antibodies. So, what is the importance? How are they contacting? So, during a period of 2 to 6 weeks, if I check the patient's blood, I might not find the virus, I might not find anything, but I will find these heterophile antibodies. So, heterophile antibodies are useful for the quick diagnosis, right? Quick diagnosis, they are the markers for quick diagnosis. Heterophile antibodies are markers of diagnosis, quick diagnosis, right? Diagnosis, markers of quick diagnosis, heterophile antibodies. Clear? So, now you are going to tell me what is happening with this patient, right? What is happening with this patient? The first important thing is that the virus entered into his respiratory system. It affected the tonsils, it affected the epithelial cell, it caused damage of the DNA over there, it caused damage of the epithelial cells over there, it broke all those epithelial cells. So, tell me what diseases can happen in this patient right now at this point. Point number one, can patient, for example, you kiss someone, you kiss someone and you transmit that EBV infection to him, the virus enters into the tonsils, and what will happen to the tonsils? Patient gonna have tonsillitis. So, here if you see here, patient gonna have tonsillitis. Not only tonsillitis, if the virus enters down into the pharynx and infect the pharynx, obviously it infected the pharynx. I have shown you in the picture, it broke all the epithelial cells. So, patient gonna have pharyngitis. But what pharyngitis? The infection is so severe that patient gonna have pus with the pharyngitis, that is exudative pharyngitis. Exudative pharyngitis. Next important thing, when you first kiss, right, when you first give a French kiss, for example, You rotate your tongue, you front and back, and then you give the French kiss. So the virus very easily enters onto your tongue and it will even infect your tongue. That infection you call it as leukoplakia. I'll show you what is leukoplakia. Next important thing is that this infection can even transmit to the skin, and even it can cause a specific rash called as maculopapular rash. Just remember it. So these are the important symptoms. These are the important symptoms which you're gonna see in this patient. This is point number 1. Point number 2 is that next thing is that this infection enters into your tonsils, causes tonsillitis. From there some B cells escape into the blood system. From there they go to the lymph node. When they enter into the lymph node, what is going to happen, guys? When they enter into the lymph node, don't you think the lymph node will swell up? When the virus enters into the lymph node, your lymph node swells up. So when it will swell up, what condition do you call this as? You call this as lymphadenopathy. So patient gonna have lymphadenopathy. I already told you that this entire process of CD8 and CD4 activation not only happens in the lymph node, but even it happens in the liver and the spleen. So when the same process is happening in the liver and the spleen, patient gonna have hepatomegaly and splenomegaly. So patient gonna also have hepatosplenomegaly, megaly, whatever it is, right? So patient gonna have these two clinical manifestations. So these are the important things which you can see. Patient gonna have tonsillitis, patient gonna have exudative pharyngitis, patient gonna have leukoplakia, lymphadenopathy, hepatosplenomegaly. So let me write all these things down here, guys. First thing patient gonna have is tonsillitis. Second important thing is exudative pharyngitis. Patient gonna have exudative pharyngitis. Third important thing is that patient was also having what? Patient was also having problem with the liver and the spleen, right? Patient was also having problem with the tongue, that is called as leukoplakia. Right? You will see whitish membrane that is formed on the tongue, right? Not only that, patient also gonna have hepatosplenomegaly. Not only that, patient's lymph nodes are affected, so patient gonna have lymphadenopathy. So these are the basic clinical manifestations, right? These are the basic clinical manifestations where one has to know regarding this human herpes 4 virus. Clear? When it comes to the labs, but before I discuss about the labs, guys, I also want to tell one very important thing, that all these symptoms are at one side, but this virus is gonna cause very dangerous cancers, This virus, Epstein-Barr virus, gonna cause some very dangerous cancers. So people who are affected with this Epstein-Barr virus are at a higher risk for developing a specific lymphoma that is called as Burkitt lymphoma. So always and always Epstein-Barr virus patients are associated with these cancers. Along with the infection, they are also going to have these cancers. What are they? One is, it can be Burkitt lymphoma. Not only Burkitt lymphoma, sometimes it can be NPC. NPC means nasopharyngeal carcinoma. It can be nasopharyngeal carcinoma, or it can also be gastric carcinoma. It can also be another thing that is called as gastric carcinoma. So, these are the three important things where one has to keep in mind before dealing with this patient. So, these are the associated conditions. Associated conditions means these are the cancers which are associated, these patients of EBV are higher risk of developing these cancers. Along with the EBV infection, patient can also have these cancers. This is very important, guys. This thing which I have mentioned is very important. Keep it in mind. Okay. Next, when it comes to the labs, how do I diagnose this patient? The first important thing is that I will find elevated levels of lymphocytes. Obviously, there is infection going on there. So, when there is infection going on in his body, your neutrophils, macrophages, all of them, they come. Any infection in your body, your immune cells come and attack them, right? Obviously, your monocytes also will come. Now, your white blood cells are abnormally becoming large with very large nuclei in this condition. Okay, in your body right now there is EBV infection. Your white blood cells come there. Right now there is infection going on in your body. So when there is infection going on in your body, all your white blood cells, they go there. There are specific type of white blood cells in this infection, and these white blood cells are having larger nuclei. So these are called as atypical lymphocytes. Okay, you see atypical lymphocytes in conditions like infectious mononucleosis. Okay, so there will be increase in level of atypical lymphocytes. So atypical lymphocytes are going to have larger nuclei. I will show it to you anyways, right? Apart from atypical lymphocytes, the next test which I am going to do is that monospot test. If monospot test is positive, that will be a diagnostic importance. What is monospot test? I told you during 2 to 6 weeks of latency, there are heterophile antibodies. So if you find heterophile antibodies, it means it is monospot test positive. If you don't find heterophile antibodies, it means it is monospot test negative. So monospot test is nothing but detecting the heterophile antibodies, Okay, detecting the heterophile antibodies is the monospot test. Next important thing is that one very important regarding the treatment, before I tell you the treatment, one very important complication which you see in these EBV patients is that EBV patients are under high risk of spleen rupture. These patients are having higher risk of spleen rupture. So for that reason, we always tell these patients not to play any kind of contact sports, because if this patient tries to play contact sports, then he will have, most likely he will be having spleen rupture. For example, if I am a patient of EBV and if I start playing contact sports, any type of sports where you see the contact, right. So in case of contact sports like rugby and all of these, there are much contact and there are high risk of spleen rupture. Okay, so the first thing you need to tell the patient is that avoid contact sports. Avoid contact sports. And second important thing which you can give is supportive care. Supportive care. As I already told you, the complications. What are the complications can be guessed? The first thing is spleen rupture. Spleen rupture can be a complication. Second important thing is, I told you 3 types of cancers, right? So there can be malignancy. And third important thing is patient also can have hemolytic anemia. So if EBV patients are having hemolytic anemia, it would be better if you prescribe them rituximab. Right guys, so let us just recap what we have already talked. Okay, so what we talked is that there is some specific virus called as Epstein-Barr virus, also called as Human Herpes-4. This comes under a family called as Herpesviridae, right? And it is a double stranded DNA virus. It is not circular, it is linear, it is enveloped. So mainly through respiratory secretions or salivary secretions or by kissing, this virus can very easily enter into your body. And once it enters into the body, first it enters into your epithelial cells, your epithelial cells of your oropharynx. As you can see here, let me put up the picture over here, let me minimize it. So it will enter into the respiratory epithelial cells of your oropharynx. There this virus will start dividing. It divides and finally it will damage the host DNA, host cell, it will break it down and finally release out in a heavy number. From there it will enter into the tonsils. Inside the tonsils, B cells are waiting there. B cells will hold this up, but the virus will enter inside the B cell and start damaging the B cells by dividing within the B cells. It will divide for about 2 to 6 weeks. 2 to 6 weeks is just division phase. So in that phase the virus is completely silent, it is silently dividing, it is preparing itself. So this is called as a latent phase. During this latent phase, your B cell will start releasing abnormal antibodies called as heterophile antibodies. Because if it will release normal antibodies, then your body knows, okay, there might be some infection, I think that's why the B cell is releasing normal antibodies, so that's not a matter of concern. But if it is releasing some abnormal antibodies, then it would think these antibodies, I haven't seen this any time. And moreover, B cells are releasing these antibodies, so there might be some infection going on, very different infection. So what is happening is that due to finally after 2 to 6 weeks of division, the virus inside the B cell completely divides during this 2 to 6 weeks, and finally the B cell starts releasing all this virus into the lumen. So at this time the viral load is too much. But some B cells are very clever that the B cell will pick up the viral particle fast, and from the tonsil it will enter into the blood vascular system. From there it will enter into the lymphoid organs, right? It will enter into the liver, it will enter into the spleen, it will enter into the lymph node. Once after entering there, the B cell with the help of MHC class 2 molecule, it will show up this virus to cytotoxic T cells, which are also called as CD8 T cells. And these CD8 T cells will suppress the infection at that time by releasing cytokines. Not only that, it will also suppress the reactivation. On the other hand, B cells also activate your CD4 cells, right? And these CD4 cells in turn activate B cells. B cells are showing up the virus particle and activating CD4, and CD4 is also in turn activating the B cells. And when B cells are activated, they start releasing EBV specific antibodies. Okay, these EBV specific antibodies are IgM and IgG. Some are directed towards the capsid of the virus, some are directed towards the nucleus of the virus. I mean the genetic material, the nuclear material of the virus. Okay. Now, what patient is going to have when the virus enters into the mouth? It will affect the tonsils, so patient going to have tonsillitis. If it affects the pharynx, it is going to have exudative pharyngitis. On the tongue, basically the leukoplakia, and obviously at the end it is going to the liver and the spleen, so patient going to have hepatosplenomegaly. Okay. So this can cause, this EBV infection is associated with 3 types of cancer: Burkitt lymphoma, nasopharyngeal carcinoma and gastric carcinoma. Regarding the diagnosis, I hope all of you know what I am talking about, right? So this is all you need to know about the Epstein-Barr virus, guys. Thank you so much.